So funny thing is, even though you're covering it, you're in front of it, but if as soon as you get to the side, even though you're the same difference.
Yeah.
Yeah, they're very directional. Straight on, it'll pick you up the same distance on the side.
Okay.
Yay.
Chair.
Sorry.
Yeah. I'm sorry. It's just great to see you here.
Yes.
Oh, you're early, so we
Yep.
can't start too early.
Yep, you still have a minute.
No. You did not. I wonder why he's that.
In a while, I forgot how long it took to get from this to here.
From the parking lot to here.
It is now officially 4, so you can start whenever you're ready.
You ready?
So I'll go ahead and call this meeting to order. Let's stand for the Pledge of Allegiance.
Excuse me. Of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Ah. All right, what's in this room? Ah, sorry.
And then roll call.
Committee Member Horton,
Present.
Committee Member Grants, Committee Member Knowles,
Here.
Committee Member Jones, here, Committee Member Schumacher, here, Vice Chair Dalton,
Here.
Chair Ray.
Here.
Yay.
Yay. Oh, that's, I know.
So the approval of the minutes from February's meeting. Is there a motion to approve the minutes?
I'll make a motion to approve the minutes.
I'll second.
Aye.
Aye.
All opposed? Sorry. Okay, and then
We have anybody out there that's
Not currently.
okay?
so let's do our presentation first, because we have a visitor. So the community partner presentation, the Samaritan Lebanon Hospital Nutrition and Diabetic Center, Heidi Womack.
Push the button. There you go.
Hello, can you hear me?
Yes.
Perfect.
Well, thank you guys so much for inviting me today. Larry Horton has been a partner with our clinic for some time, and he reached out to us and asked to be here, and I'm really, really excited to be here. Our department does have some new exciting things coming, so I'm excited to share those with you guys. My name's Heidi Womack. I am a registered nurse, and I'm a diabetes educator, certified diabetes educator. I have my little bee on there. Our department has a mascot. We're the honeybees, and so we buzz around and try to help people as much as we can. So our available services, we have diabetes self-management therapy, we have medical nutrition therapy, and then we have diabetes foot care. One of the things we like to tell our patients and our providers is that we have the luxury of time. Many times providers are limited to 15 minutes, very short appointments. We're able to see patients up to 90 minutes at a time. So if patients are struggling with certain things, we really have a lot of time we can offer to support them. Diabetes self-management therapy is covered by most insurances, including Medicare, Medicaid, which is Oregon Health Plan, IHN, and commercially available plans, so through employers. So for the most part, we can cover pretty much all of the community if they have diabetes and would like services. The diabetes self-management therapy is available as group classes or as one-on-one individual visits. We actually had a meeting today. We're going to be restructuring our program to offer a la carte classes. So patients will be able to choose what topics of classes they would like to attend. We'll also be offering all of our classes virtually. We're hoping to have that option by July. Diabetes self-management therapy is overseen by some accrediting bodies. Ours is what's called the American Diabetes Certified Education Specialists, and they have 7 self-care behaviors that we speak to for patients. So our program is structured. We do have a curriculum that is based on those self-care behaviors. We focus on healthy eating, activity, healthy coping, how to monitor blood sugars, and medications and problem solving. So if there's things that arise, we try to teach people ahead of time, how can we support you looking forward as things go on. Our medical nutrition therapy, we have registered dietitians that provide evidence-based nutrition counseling for patients. We are specialized in prediabetes and diabetes nutrition. We have classes that are offered for that, and they have been very popular. We try to limit the classes to about an hour to 90 minutes, and it gives a really good overview for anybody that would like better nutrition information. And then one-on-one, the medical nutrition therapist can help patients that maybe have more specific needs. We can help folks that maybe have complications from diabetes that involve their liver or their kidneys. And then how to identify foods that specifically will raise blood sugars and how to manage those. And this is my favorite part, diabetes technology. I'm kind of a nerd, and so this is my favorite part. I've been in our diabetes education department for about 8 years now, and I would say that about every 6 months there has been a major breakthrough in diabetes technology. So it is a fast-paced environment. The other wonderful thing about diabetes technology is that more and more insurance companies are covering services for patients. So it's much more available now than it used to be. What we can offer to patients, we can assess patients for eligibility. Are they eligible with their insurance plan for diabetes technology, and what would that be? We can coordinate with primary care providers to help order that technology for patients. Once they receive the products, we can provide training specific to that product. We can provide troubleshooting tips if things aren't going well, and then we can interpret results. So once they come back, we can provide, is this working well for you? Is this not? Our program also allows educators to adjust medications underneath the physician. So if they come back with that technology, we can say, this isn't working well, let's adjust this medication, or let's adjust this nutrition piece. So it works very well together, very cohesive. Glucometers are kind of a staple. They've been around for many years, and we can also assist patients with those. Mostly troubleshooting, what do those numbers mean? What does that mean for your health? How can we improve those numbers? What are your goals with those numbers? So we have a lot of that. So the glucometers are one. These are pictures of the continuous glucose monitors that are on the market. Most of them have phone apps, so patients can use a phone device. Many of them have the option to upload that data to a cloud service, so we can do virtual visits with patients. They don't necessarily have to come in. We can see their diabetes information remotely. So any kind of glucose monitoring, we offer first-time training. Diabetes is very heavy in numbers. And there's a lot of different numbers to try and keep track of. So that's something that we can help patients navigate. What do these numbers mean for their health? We can help patients set goals. Everybody is individual. Diabetes is a very individual journey. So we want to make sure that patients have an individual goal for themselves, not necessarily based on what everybody else is doing. How often do they need to test? And then we can assist patients with ordering. Sometimes the ordering process can be very confusing. So we can support providers in what brand needs to be ordered, how much of a specific supply needs to be ordered, and how often it needs to be ordered. So we can support our folks with that. Insulin pumps. This is an expanding area, pretty rapidly expanding area. It's still limited to a fairly limited population, but it is expanding. Insulin pumps deliver insulin, and many of them are automatic. We do have insulin pumps that have artificial technology in them, artificial intelligence. So they are pretty exciting, and we can help patients navigate that process of ordering the pump, how to start it, set it up, and then troubleshooting and ongoing support for the insulin pump. So here, who's right for a pump, initial training, and then rate adjustments and optimization once they do get the insulin pump. The Diabetes Foot Clinic, this is a very popular clinic. We provided this service, I believe, has been around close to 30 years now. And it is a Medicare covered service. So patients are able to bill Medicare for their foot care. We provide nail trimming and filing. We monitor for skin integrity issues, and then education on how to care for feet at home. People rarely miss these appointments. They're usually pretty happy to come in. The requirements for our foot clinic, Medicare and insurance tend to be fairly strict on paying for it. They want to make sure that it is a necessary service. So we do have to have some hoops we jump through. We have a secondary condition, an annual foot exam, and then a referral. But our providers in this area have been very supportive of this clinic and have really helped us navigate that process. So our beautiful new clinic in Sweet Home, we just love it. It's beautiful. In December, we were finally able to navigate coverage and find a spot. So we are able to provide some services for diabetes in the Sweet Home Clinic. I go there on Fridays. I share a space with one of the pharmacists. And I can provide one-on-one counseling for patients here in Sweet Home with nutrition. I can help with monitoring all of the technology. I can help with medication adjustments and then ongoing support. More to come. We are working with Samaritan. There is more space potentially available. We are really hoping to expand and offer classes and foot care in the future here in Sweet Home. So that is us. There's our contact information, our phone and our fax number. We'd love to hear from you guys if you have any support or comments for anything. Anybody have any questions about our services?
If I may, what's the number in your client base?
Oh, sorry, what was that?
What's the number in your client base? How many patients do you serve?
How many patients do we serve? Oh, that's a good question. I believe it was 1,200 the last time we looked at, and that is actually a small fraction of the patients that we could potentially serve.
Yeah.
So we're constantly marketing and encouraging folks to come. We actually, we had a meeting today, and my manager has been compiling our annual results. And we found that if patients attend our program, they see a reduction in their lab values, in their A1C lab values. So we are seeing very good results with our program.
Adam, can you back up the slide on the contact there? Because I got up to 6 digits and I stopped. I wasn't writing fast enough.
I actually just uploaded this presentation to the agenda packet and
Oh.
republished it, so you can find it on the
Yeah,
website.
yeah, that'd be great. Good. Actually, I have a question.
Yes,
Since we do a health fair this year, would you like to be in attendance at that health fair?
that would be wonderful. I'll bring it to my manager.
Because I think that would be awesome to add that to our health fair. And even if you had some of the monitoring equipment available
Yeah.
so people could see. So
That's a
I'll
wonderful
give you
idea.
a contact for me. So
appreciate that.
It would be a great add to our healthcare.
I can assure you they are very efficient. They know what they're doing, and they have made a big difference in my diabetes.
So now I understand the connection there.
I have a long history with them, especially Angie. She has been there for a number of years, and
Well, it's interesting to see your deal about the foot clinic and going, man, Bob Dalton here has neuropathy really bad, but it's because I take chemo, so it's a different situation, but when I could really relate to the foot part of that,
Mhm.
boy, that's like walking on needles for me most of the time, So, yeah.
I really have to applaud the entire unit. We've been working for years to try and get services here in Sweet Home. And for years, they said no, 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 no. And I guess finally they've beat the walls down enough that not all services are currently offered here, but I guess a growing number of those services are being offered. And I just really appreciate what you've done in order to make that happen. It's not an issue for me to get to Lebanon, but it is an issue for a huge number of clients here in Sweet Home. So maybe you'll end up with more patients because of that. I'm hoping you will.
We've had excellent feedback so far.
Good.
Patients have been very pleased.
Have you been doing it since January?
December, yeah.
Since December.
Yep, every Friday. And I've had really positive feedback from the patients that have been able to attend.
So you're pretty full on Fridays.
Yeah, I get pretty full.
Good.
It's been a really good experience.
Excellent.
Yeah.
Thank you, Heidi.
Well, I know, Heidi, my personal experience with the dietitians in Samaritan, when you went back and said, we have time, every time I've contacted, they've been that extra time. I'm like, okay, 50 minutes is up, Bob, you got to talk fast. And, I'll be on there sometimes with them an hour, and they're very great about explaining each piece of the puzzle for your diet. And alternative methods even, I'd talk alternative, and they were right there supporting it. I mean, they were very knowledgeable in what they were talking about, and I did appreciate it. Except for me, it was the cancer word, and I talked to you earlier, I was really pushing nutrition for people with cancer, because for me, I look at it from a different, you're talking diabetes, which I have good friends that has some of that monitoring equipment. It's amazing how that works. That little patch, and it's just the phone, it's there, she knows. But for me, it was like, okay, what foods? And we talked about that. And I'm sure for diabetes, it's the same way. I mean, I count calories. I look at sugar contents. It drove me nuts because my glucose kept climbing all the time, and said, Bob, you're fighting something you're not going to win, because the meds you're taking is driving the glucose. And I was like, don't eat the cookie, Bob. Just don't look at it, And I go back, my glucose was up high, and I go, gosh, I was frustrated with it.
Yeah.
And it was just medicine driven, So good point of what you was tying in with medicines and that. So
Yeah,
So-
we try to be pretty comprehensive and include all of the pieces together.
Yeah.
We support folks.
yeah.
Diabetes is a difficult journey, so we want to make sure people
Amen.
feel supported. Yeah.
With your diabetes education, you include families too, like, I'm sure Dick's a great cook, but Larry's a great cook, but it's like, the husband is the diabetic, the wife does the cooking, so you bring them both in and help them
Yes.
both to work through a meal planning.
Yes, we do. We really encourage folks to bring support family members with them.
Yeah.
So,
It also helps to marry a nutritionist too.
Oh, well, you got it in.
That helps a lot.
Yeah.
The nurse doesn't.
A nurse is really good to have too, but
And I would just add, from a primary care standard, because I'm working with primary care clinicians, they're doctors and they know about diabetes, but having the involvement of diabetic education is huge in patients' journeys. The clinicians do not have the same understanding. They don't know the requirements for how to get things approved, what steps need to take place, and the value is significant. And I don't know of any patients we've had who have actually been involved in diabetes education that had a negative experience.
Okay.
I think it's just been positive, and we really appreciate the work. And we would love to have you be able to expand your space.
Angie's working on it. I have a wonderful manager. She's very persistent, so she's
She
working.
is.
So
And it does not have to be a Samaritan patient who's seen at,
right. Yeah,
Are-
we can see all patients.
So how are you advertising that it's now available in Sweet Home? Or are you doing any kind of,
A lot of it is when patients are called for their referral, when they're referred
Right.
to us. If we notice they have a Sweet Home address, we try to offer that as an
Okay, good.
option for them. Or if we've had patients that have been involved in our program for a while, we try to let them know, oh, did you know we also have available services in Sweet Home now? And it's been very well received.
I don't know how popular the newspaper is now, but I'm thinking maybe I should be sending a letter to the editor just saying that it's available in Sweet
Mhm.
Home. You may want to take a look.
Mhm.
I'll try and get on that.
Well, I think the education piece you're talking about, working with families and people is awesome. I mean, I had a good friend who was a diabetic. I mean, he was full-blown diabetic. I got so frustrated with him because I was sitting in a restaurant with him one day and I could see the sweat break out on his forehead. And I thought, what's going on here? And pretty soon he was putting lots of sugar in his coffee. He was loading it up, started sweating here through his shirt. And all of a sudden he was looking at me, but he wasn't answering. He was going into down.
Yeah.
And I was ready to call the paramedics. And then I asked the gal to bring me some orange juice, popped that orange juice in him, and it just stopped it right there. It just brought him right back. But it was how quick it changed. And he told me, he said, well, if you ever see this again, just put sugar in my mouth. I said, I'm not sticking my finger in your mouth here. But what confused me, he took insulin, 3 shots a day. But a vendor would come in with a box of donuts and he'd eat 2 or 3. I'm like, what are you doing? I'll just take a shot. I go,
That's right.
Not
Just
how
take
it
a little
works.
extra.
So it was, but to see what was going on with him and how incoherent he became so quick within just minutes. Just, I wasn't prepared for that. I hadn't saw that before, and now I know what to do in case of, but yeah, it was quite an experience.
Yeah, there's many factors. Yeah, and everybody's journey is unique. So
Yeah.
that's why we encourage folks to come see us.
So my question is, you said it's covered by Medicare and everything.
Yeah.
Is there usually a copay associated with that?
That's a good question. It depends on the provider of the Medicare plan. This area recently had a big changeover with Medicare. I'm sure some of you may have heard about it. And that new plan has had a copay where the plan previous did not. However, we've also found that registered dietitians don't have a copay where the nurses do.
Mhm.
And so some of that is kind of trial and error. But we do offer one of the things that we counsel patients with is financial resources. We very heavily encourage folks to apply. We have a Samaritan Financial Assistance Program that is very generous. There's Medicare Extra Help. We have all of those resources. We try to make sure that patients have those available. And if we can help them get connected with those resources to cover any copays that might be out of pocket, try to reduce those barriers as much as possible.
Great.
Thank you.
Yeah, thank you.
Any more questions? No. Thank you.
Really
Good job,
appreciate your
Heidi.
time.
Thank you so
Thank
much.
you very
Thank you so
much.
for having me.
We appreciate it. I'll make sure Angie sends you a bonus. Yeah, my pleasure.
So moving on to new business, health fair / banners. Let's see.
Shouldn't have put this on the agenda. No, the reason I put that on the agenda was just a heads up. In May is usually when I start the process of sending out applications for the health fair. And one thing I'll do for all of you here is I'll send out a list of the participants we had last year. I won't send it to Dick because he already has it but I want you to all to look at that and see if there's additional resources you'd like to see added to that event. And if you know other vendors out there or resources or whatever, let me know who they are. I'm already on the hunt already. for that. So I'll be sending that out and then we'll just, like I said, in May and then June, the applications start rolling back in. Usually they wait to the very end or the 1st of July. It's always kind of a crunch time, but we got to start putting our thinking hats on that because it'll get here before we know it. So just a heads up on that.
So before you leave that, are the applications online or do you literally mail them to?
I have all of their email addresses, so I just attach it to an email and shoot it.
Do you have this presentation email address?
We do now.
Probably will
And-
now, yeah.
Yeah, okay. I was just going to follow up with Angie if I
Good, I'll
needed to.
assign that one to you.
That's fine.
No,
Where's
No.
the app?
no, and I'm looking forward to, I mean, this is really our 10th year of doing that. And it doesn't seem like it could be 10 years really in the making. And I was fortunate this year, that Samaritan stepped up with support for us this year to our group. And I think Cicely sent that to you just so we could get that all taken forward. But they wanted to be a presenter or not presenter,
Sponsor?
sponsored. Thank you very much for the event this year. And it kind of caught me off guard because that
Wow.
was her first year there last year. And I told her what it was and what she experienced. She says, I want to sponsor this group next year. So it was quite something. I wasn't looking for that. And it just presented itself to us. So
Excellent.
it made me go back and think, okay, there's other sponsors out there. But anyway, put your creative hats on. Think about things that we would want to add to this year. So the banner piece of it, we're just thinking I want you to start thinking about other banners. I mean, we only have a few banners that we've purchased to put out around the community to make them aware of the event. We put one down at the Samaritan at the next to Thriftway. We put one there this year. We put one at the police station out front there. And I think we had one other, but I feel like we need to do a different approach to getting the word out for the health fair. And also I'd ask you to think about that process. We put flyers out. It's a hit and miss. It's like, I want to go to Bi-Mart. Can you put them on your grocery bags for us? And I might ask that question. But think about ways that we can put that out in the local newspaper. Scott's been good about doing that for us, but are there other ways that we can communicate this event? So be thinking about it. So that's really all I have on that, unless others have questions around the health fair. That's quick.
I don't have questions, but what about like yard signs, like the ones that you put on wire rack? Is that something that we would be able to put in the median where the fish and the flowers are?
We have been discouraging people from putting that stuff in the median because we've had to remove stuff. I mean, we have over the years, and so we've just stayed away from that. So, yeah, because if we allow one person to do it, and then everyone thinks that they can do it, and so we've just stayed away from the median. So,
Well, I was thinking about adding one more banner, maybe with Mike Hall at the Point Restaurant, because a lot of people gather there. And I thought there's not a bad place and I know Mike would probably let us put it up there, but I thought that's a pretty good stopping place for a lot of people driving in and out of town, but yet the people that are actually there. So I think that's an opportunity for us as well. And then for the health fair too, we have some leftover support there from our budget where we can spend. There's information, pens, refrigerator magnets, and some things like that we could give out in the health fair from a check-in desk or something. We could possibly pick up some of those small items like that. They're not very costly. So if you think that would be an add to help, then let me know.
What do you think about like the Rock? The Rock show every year puts a banner all the way across the road.
Mm-hmm.
And I think it's both ways, but people have to drive under that every single
ODOT has not allowed that banner for
Yeah.
the last several years.
Really?
Yeah, we
Yeah.
tried that.
Oh,
Yeah.
darn.
Yeah, because we have that banner. I have it rolled up in my garage for storage, but it's like, okay, what do I do with this thing now? But
That has been the transfer to the fence at Thriftway. So the Rock Show moved their banner to that long
Okay, that's
fence.
where I saw it.
and that's where we've been putting our banner up there. They're real good about letting us
Okay.
do that. So yeah, if anybody wants a banner that goes clear across the road, I'm sure we can hook you up with one. I don't know, maybe I can fly it behind my pickup, just drive real quick through town, but you'd probably stop me for speeding to get that thing stretched out there. So probably not a good idea. So, all right. Thanks everyone on that one.
I'm almost thinking maybe something across Weddell Bridge because so many people go to Sankey.
That's
I don't know, something to think about.
That's not a bad idea. I mean, yeah, because I've been really taking time to come by that park since the group had put so much effort in continuing. And, I was down there last week and the park was full of people. It was just full of people. It was good to see that, so good idea. I appreciate that, Cicely.
Any more for the health fair? What about mental health resources? I think that's a you.
Yeah, everything on this, I put on this, and it has to come back to me. The mental health resources, Wyatt touched on that. As a committee, we've talked for years about mental health. And I've had some good conversations because my wife's going through that issue right now. And it's a very rough journey for a caretaker. But what I found in this process, that part of the system is really fragmented. And it's been very frustrating for me, and I'm sure it's frustrating for other people. When I went to try to find her a counselor, I was told to go to psychologytoday.com and find one. Are you serious? And they were serious. And the frustration with that, then I went online, and of course, they're spread all over the state of Oregon. You choose one as close as you can, which Sweet Home obviously doesn't have them. Lebanon doesn't. They're kind of hit and miss. But what I got frustrated with so many of them is 2 and 3 months out. And when I think about mental health and what people deal with, we have people that are displaced on our streets that are obviously dealing with some mental health issues. We have domestic violence that I'm sure Jason and his team have come across. I just look at the shooting that took place in Louisiana, where a father goes in and, takes the lives of all these children. And it just really brought it back surreal to me that we're not just getting there. And, as a group, what can we do to move that needle some? Not going to move it all, but as a group, what can we do? And I think back when we talked about when people were displaced on our streets, the city came in with ordinances and things trying to manage that process with some success, but not with a lot of success. And then we went back and we started having talks about some sort of a community or a place where they could land. And in the beginning, I remember that process. There was a lot of we can't do that talk, and people weren't bought into it. The city council wasn't bought into it. They just didn't know how to handle this guy. But we eventually started out by just having discussions. And I know Dick and I and Larry and some of us, we started to sit down at the table, and at the previous police chief, we sat there and started having these conversations. And that's really what kind of blossomed it, was getting people to the table. My frustration was with my wife was the idea that when we were trying to figure out what was going on, you get a hold of a mental health specialist that does an interview with you over the phone, pretty impersonable. And then that report ends up on a psychiatrist's desk that you never meet. You don't know who they are. And then they send in a prescription for medication. And for me, I could see where a lot of people would follow through the cracks with that process. They wouldn't know how to navigate it. For me, I have the patience to navigate it, but I think a lot of people just wouldn't just give up, And so I'm still in the hunt for a counselor. I've been at this for 2 months, and here I got a wife that is really in crisis, needs it, but I can't get it. So I look back, I was thinking about the police department, and the officers, how they have to deal with that and confront that, and do they have the support and resources they need to be successful? So for me, it was like, what do we do and how do we do it? We can put up mental health signs all we want all over town about awareness, which we can do some of that. And some of it's the resources list. I mean, um, the Samaritan Doctor, our primary care, actually came up with a group called Breaking Free out of Lebanon. I didn't even know they existed. And when I actually talked to them, it was a refreshing experience. There's someone here was saying yes, and we can set you up some time. And, they got like 4 counselors. But like I said, do we really know who our resources are? And I was thinking as a group, can we put together some sort of a resource list out there that's around? I mean, we have them, but around mental health, it's so different. If you haven't walked in those shoes, you don't know what that's like. So that's kind of why I was talking about this mental health for us to maybe start having those kind of conversations and see how we can support Samaritan, support this girls group and others, because there's that disconnect between all of them, so I mean, that's why I brought this to this attention, because we're back again talking about it. So,
Well, I know that the consortium, the community consortium had a directory that had a list of many different things in there that referred people to mental health, housing, all that stuff. And I think that's something that I haven't seen for a while. It's probably online now, but
It's
used to
still,
be-
yeah, it's still there.
You used to be able to just go into the consortium and grab one and you had it. So, I mean, that's a good resource to start.
and some of that too is, and I talked to Wanda about that as well, because it's like mental health / resources, is what resources do people have access to? Some people don't have laptops. Some
No.
people don't have cell phones. They don't have vehicles. And one of the things I came across, Lisa Gorley brought to my attention, her husband Jim had had a stroke, and he ended up in, I think it was Corvallis and then on to Salem. But she was talking about their resource library. They had a central location where they was at that just was a multitude of resource information for anybody that walked through that door. And I'd actually talked to Wanda a bit about this. I said, could Samaritan have some sort of a resource when you walk through the lobby? Because a lot of people are just sitting waiting for an appointment, but there's no information other than the tell and sell. And that's no fault of theirs. They have a great monitor up there. They're rolling it. But it was like, can we go above and beyond? Lebanon Hospital has a library, which I never thought that library they had was available to me, because I just walked there and I go, it says library, and I go, so I walked by it, but I never thought that I could actually go in and access that information. And I think a lot of people sitting there probably thought the same thing. It's a library made for staff and not the general public. And I know managing some of those things has got to be an issue. If you put up the pocket card holders, who's monitoring it, who's making sure the information's not old? Because I've seen bulletin boards where you look at there and wait a minute, that's been there 10 years. It's been covered up 3 or 4 times with something else. So, but it was my question about how can we get better at putting resources out in front of people. So that's really what I want to just talk about and generate the thinking process on that. It's awful quiet.
Well,
Go to see. That was mine too.
I'm just thinking about, as always, it's maintaining the list. And, there are resources out there. There's Sarah's Place in Albany. There's Cardva. There are specific resources for specific issues. But how do you list every resource? And there aren't a lot of resources in Sweet Home. People have access to Lynn County Mental Health depending on their coverage. And that's another issue, is more and more insurance companies are are managing who their patients are able to see. So it's like your clinician may not even know who's on your list for your insurance provider. You're instead have to call your insurance company and say, can you give me the list of who I can see in this area? So it's definitely a challenge.
Well, that's the one thing I ran into contacting the different counselors I did. First question they asked, what insurance do you have? And they had a pull down. And sure enough, most of the time, my Moda insurance is not listed there. It wasn't there. They had some out of network type insurance facility. So I thought, well, there's another obstacle for someone that is wanting and needing mental health, but they don't fit the criteria. So anyway, I mean, one of the thoughts I had was actually going, and I think Wanda had mentioned that too, was central locations for these resources. But I was thinking about the public library. You know, does the public library really have, and it's something I've got to contact them and ask them, do you really have a section that is here about health resources and information around diabetes, mental health available? Don't know. I'm going to ask him, could you have that? And put some thought behind it. Maybe there's some grant money out there that would let them do such a project. I even thought of the idea of they have laptop computers in there. If one would be maybe dedicated to just health, I don't know.
So our director actually just received a grant. So we will be getting several laptop computers that can be loaned. And one of the focuses of that grant is access to healthcare. So once we have those in hand, we do plan to advertise. And so you can check them out for a week, use them for appointments, whatever you want. And we're also going to be donating one permanently to the senior center.
And
So-
the CSC resource book is, last I checked, was on, on their shelf actually, as you stand there at the counter. So it's been there forever. And out of date, I might say. That really is
Well,
a
that was
huge.
the problem that I feel like a lot of the
Yeah.
places that were printing these mass directories were running into, especially when COVID came around, is the information was out of date almost right after you print it.
Yeah.
Something has changed, hours have changed, services would look different. So everyone went away from the printed materials, and that's why when we did the resource list that we spent a lot of time on,
Yeah.
I was like, let's put this online, and if people want to go to it and print it out, and I need to go back and look at it because I decided to have a baby and not do any work for a while. So I'm sure that there's potentially things that are on our list that are also out of date. But the nice thing about it is there is the categories, and I know I've gone to our website, and when I can't find the Word document in my computer, and tailor made it to what I needed to send a patient and print it out to just specific highlighted information for what they were needing. And there's no reason that we can't expand the list. I know we were very intentional when we first decided to put it out that we only wanted things that were really significant to Sweet Home and not, yes, Sweet Home people have access to this, but they would have to travel, or then you start looking at all the other barriers there are for care. But if we want to expand that list, then that's also a conversation we can have. Or if there's things that we feel are missing from that list, then we need to have that discussion as well, I guess.
Well, one of the things I do too, I notice, when I go to different facilities, I see a lot of monitors like this that are blank. And I'm thinking, what an opportunity if you're sitting there. Safeway was when I bounced here just about a month ago. I went in there to get a vaccination. I looked in there and I personally asked him, I said, you got a great size monitor, but it's blank. And I said, what an opportunity for people while they're sitting here to see some of this information being thrown in front of their faces. It hasn't worked for years. And I go, it doesn't work. She said, no. And I said, who do I need to talk to? Because for them, it was out of sight, out of mind. And I understand it. You got to manage it. You got to program them. I get it, But the fact was there was an opportunity that they didn't see that would even enhance their services, So I'll still beat my drum out there, I guess. I won't lack off of them. But thank you for listening on the mental health piece of it. All right, go to transportation. I'll talk about that one now.
Transportation, Bob Dalton.
Well, yeah, I've got everything up there. I'm just going to quit sending Cicely anything put on this list. I was going to say, Kelsey. The transportation thing was actually brought up, I think, a month ago or something. We talked about it a little bit. I know Wanda did. I was hoping Ken was here because there was some questions around the uses of our transportation. Or they go into the places that they all need to be? Do people know how to access them and operate them? And Ken said, I don't understand why people don't know how to operate them or that. But I went around and I looked at some of the stuff that's actually at where people stand and wait. And to me, there was an opportunity for information in those booths on operating schedules and where they go on that. Some of of course, they get marked over, some of them too. That's the bad part about putting stuff like that in there. People, they, destroy it and mark it up. And, but I just put it up there because Wanda, have you seen anything different on the transportation side of it that needs to be addressed? I mean,
Well, I think they have schedules. I think the bigger problem is educating people about how to use the system. Like the big bus cannot get into our driveway at the facility. So if a patient is coming from Lebanon who has mobility issues, they're going to be dropped off on Highway 20, on the corner of Highway 20 and 49th. And they have to get into the building on their own. However, there are solutions to that. If they take the big bus from Lebanon and go to the senior center and have scheduled a ride on the smaller bus, they can get directly to our door. But people don't understand that. And so I just don't know. I mean, we've had them come and present at our clinic to our staff and clinicians because we don't understand the process. And so how do we help our patients understand the process who are struggling to get there? Because we have patients every day who I can't get to my appointment. So I just don't know. I mean, I don't know if they do education. Again, it's the same dilemma of how do you reach the people who need to hear it? How do you get the information to them? You can present at the senior center, but the only people that are going to hear it are the people who come to listen to the presentation. So I don't know the answer to how we start to educate people that no, there are solutions. You just have to plan ahead.
Work at it.
And understand what you need to use. And like we have people that I can't afford the dollar for the transportation. Well, we have vouchers that we can give to patients, and we do. And the senior center also had grant money that they have vouchers that they can use. But do people know that? That's the challenge that I see.
Yeah.
I was going to say, look at you having.
Bob's looking at me. Yeah, but we whenever anybody comes into the senior center, I mean, one of the ladies at the front desk are more than willing to educate them on the bus system and how to work it, even on the phone. You need to get to here and here. You can take this bus number, it'll arrive at this time. And then they'll call the driver immediately to tell them they have another pickup and take it to here. And then from here, you can get on this bus number to get there. So even on phone, they can give them the information and people will at least can get to where they need to go. What we're going to try to do is in the bus stops, we make sure that the bus schedules are posted. And also we're going to be adding a senior center information flyer in there too. We're in the process of making it up so that they can know a phone number for the senior center, that this is access for information on all of these things and the classes we offer and every services we offer and everything else. But yeah, I can't tell you the number of times I've sat there and heard the ladies at the front desk say, okay, so-and-so, you need to get from here to here. Okay, this is how you do it, and so they do the education process all the time.
I would absolutely agree with that. I've had nothing but helpfulness, and I mean, they're wonderful. I've been on the phone with them before and we were having a discussion. It's like, I don't understand how you can't get the bus into our driveway. And at that same time, the bus drove by my window and it's like, oh, well, that's a really big bus. I didn't even realize you had a bus that big.
Yeah.
And so, you know, and they've come and presented, they were wonderful, and they go above and beyond to help patients. But I think that people don't ask. I don't know how, they don't communicate what their needs are.
Yeah, and maybe they don't feel comfortable riding the bus too. So, but we're getting. I think we have a new what they would call the shopper, which is a small bus. But a lot of them, you just call and they put you down in the schedule, and they come and pick you up. And then they ask you how long you're going to be, and they come back and get you. So it's a great service, and it's available. It's just
So
figuring it out.
the drivers of these buses, are they just drivers? Or do they actually talk to the people that are riding on the bus and explain the process to them? I mean, I don't know. I mean,
Not really. I mean, they will, if somebody asks a question about a bus route, they can hand them a flyer, but really they have a schedule to keep and they need to focus on their driving.
which I understand that piece, but you know, if you got on a bus and the driver announces that these are our destinations, and if you're wanting this is probably not the bus you need to be on. I guess, you know, there's maybe an opportunity. I don't know. I've never rode one of these guys, so I don't know anything about them.
I
but
don't think so. I think people usually, when they get on the bus, they know where they're going. And so they just,
Yeah.
they either tell the driver where they're going, and the driver will keep an eye out and drop them off and keep an eye out for them to
Okay.
make sure they get off. But yeah, because sometimes there's so many stops along the way from so many different people asking for stops or a pickup
Yeah.
that they really can't announce everything.
Sure.
Yeah.
Okay.
And I do feel like there's opportunity for like our clinic staff to help educate people, which is why we had them come and present to us, because I feel like it's part of what we need to help our patients understand when we know they're struggling, and just knowing that they can reach out to someone at the senior center with
Right.
questions.
The fact that you have vouchers, I think Shem also has vouchers for people if they're having transportation problems to get to use the bus system. And we have schedules there too. So they're available. It's just people understanding them and asking for help.
Well, like I said, I was hoping Ken would be here on that.
He's gone for 2 months.
Yeah, July 4th.
Can't do that. That's all I really had on transportation. It's something that's just an ongoing process. So again, I think it's an opportunity for us to put our thinking caps on and at some point and, you know, reach out to some of the recipients of the bus or whatever and see if we can't clarify some of these issues.
Do they ever attend the health fair?
The one group from
Yes, they
comes every year.
Yeah, they usually have
Bus.
the bus. They usually bring a bus I think even when it was inside last year, they brought a bus and they have flyers and information, and they talk to anybody who walks up to ask them information. Yeah. They're usually at the health fair every year.
Maybe we could put something in the water. It'll just happen. Strike that one.
Anything else around transportation? Any committee business for the good of the order?
I had one thing, and I don't know, maybe one of the presentations we had before, they talked about it, but we had some Western Health Science. People come to the senior center the other day and they want us to hang up a flyer, and they're looking for participants to, for fall risk. And, you know, if you're falling or if you're at risk for falling, and a phone number. And what they're doing is I guess they're holding classes. And from what I hear from some of the ladies at the senior center, it's a wonderful class. I mean, they talk to you about getting up from chairs and out of bed and, you know, watching for throw rugs and the whole 9 yards. But it's an excellent opportunity, and they're looking for people to participate. So I don't know if they've put any in the clinic up there in Wiley Creek, but they're trying to post it more and more and trying to get people to involve. So I think falling is a huge thing. One of our quilters fell, broke her hip. So fall's a huge risk in our population.
You're an expert.
So Dick's walking with a cane. So, but anyway, I just wanted to bring that out, that the health sciences, Western Health Sciences is doing that.
Yeah, I saw one of their flyers I went to Sugar Vibes to get a donut today and they had one flyers up, so I stopped to read it. It was so good.
Donut, you had mentioned that to me.
Maple bacon donut. Anyways, but yeah, I thought, wow, that was really cool because that's something that obviously we talk about with a lot of patients is
Mhm.
fall risk. And so,
If I might, we kind of jumped over the subject. May is Mental Health Awareness Month, and we have a bunch of posters or ground banners that we put around town. So I just make people aware. We usually sneak one or two in the median, and it's fine if we don't, but they usually end up in front of his office. And so just be aware. It's got a Sweet Home emblem on them as well, so it ties together to the group.
any more business? Meeting is adjourned.
I don't know if you contact information, so when you give me that list.
So tell